Thank you so much for inviting me to speak with you today. What a year it's been for everyone. The past few months have been a test of our endurance and determination as we have fought against COVID-19. We've had to change how services are being delivered at every level. While it has been stressful and exhausting times, I can tell you that every day, all across Virginia, clinicians and staff from the state and community behavioral health systems are showing up and getting the job done. We are pressing to ensure needed services are available, all the while still working to transform the system to make it better for people with behavioral health disorders and their families. I'd like to share some bright spots with you and briefly mention how we'll be overcoming challenges in this current environment. First up, I want to discuss STEP Virginia. You're likely very aware by now that STEP Virginia is a framework for ensuring access, consistency, quality, and accountability in Virginia's 40 community services boards, or CSBs. STEP Virginia services such as same-day access and primary care screening have already been launched and are implemented in effect, and efforts are currently underway to expand outpatient services, mobile crisis, and the crisis dispatch. COVID-19 has, of course, impacted the way CSBs conduct STEP Virginia services. For example, for same-day access, there are currently 70 locations across Virginia. CSBs are using drive-up services, symptom screenings, and utilizing telephone and telehealth assessments. The next steps in STEP Virginia are to add military services and peer and family services. Another very bright spot is alternative transportation. We contracted with a company to provide alternative transportation services for individuals using unarmed drivers wearing plain clothes in secure, unmarked vehicles and with specially trained drivers instead of the individual being handcuffed and shackled in police vehicles. The program was rolled out last fall for adults in Southwest Virginia. Region 1 services started earlier this year in 2020. Last month, the services went live in Region 5. That's the Virginia Beach and Tidewater area. We have plans to roll out coverage to the rest of the state. Soon, alternative transportation will be statewide for adults and children, fundamentally changing how people under TDOs are transported to inpatient psychiatric treatment. I also want to talk a little bit about the state hospitals during COVID-19. We're doing everything that we can to ensure that the state hospital bed safety net stays available during COVID-19. First, all of our DBHDS facilities have been doing a remarkable job preventing COVID-19 through some real effective means, heightening infection control measures, isolating positive cases, and implementing policies such as rigorous screening for staff and patients. Over the past several weeks, we saw our highest number of positive cases at over 100 patients and staff, and that affected 11 out of our 12 facilities. 4 hospitals have had to close temporarily to admissions because of COVID-19, and 1, the Commonwealth Center for Child and Adolescents, remains closed as it fights the virus. Thankfully, last week we saw a significant drop in cases. We will remain vigilant and will work to maintain state hospital services and ensure safety for patients and staff throughout the duration of the pandemic. COVID-19 has also had a massive impact on community-based services. The CSBs have worked so very hard to make sure they're still providing all of their code-mandated services. We were very thankful that changes in state and federal regulation have allowed telehealth to be expanded. Private providers are also doing all they can to ensure continuity of services. And yet we know that these community services will be required even more in the coming weeks, months, and beyond. Virginians are increasingly at risk of depression, anxiety, and substance misuse. Also, a recent survey conducted by DBHDS and other partners across Virginia asked pediatricians and family doctors about the impacts of COVID-19. 88% of those providers stated they are seeing more of their patients present with mental health symptoms since COVID-19 began than previous. We must press forward to answer this call for additional services. DBHDS has several community behavioral health programs already underway that are working hard to address these issues. Just one of many examples is the Adverse Childhood Experiences, or ACEs trainings. These are new trainings that are virtual, and we've actually trained about 2,000 people since May to better equip providers to treat and help children who've experienced trauma. Another wonderful example is the COVID-19 Warm Line. And we are so pleased to be partnering with Mental Health America on this critical program, which has been extended with funding through May 31st of next year. The Warm Line provides an opportunity for any Virginian who is struggling during the pandemic to call and speak to a peer who will offer emotional support, active listening, and referrals, real referrals. Bruce Cruiser and the team at Mental Health America Virginia did a great job standing up this program. You guys jumped at the opportunity to meet the behavioral health of Virginians' needs, and then jumped with us through the federal requirements and deadlines to make it happen before funding was even assured. Your risk was worth the reward. Your expertise has made the program successful, and we will keep working with you to promote it across the state. We are so grateful for all that you're doing to help meet the needs of people who are struggling during this challenging time. Finally, I want to say thank you. Your work keeping mental health issues in the forefront is invaluable to us as we make the case to the General Assembly and state leaders to advocate for programs to modernize and improve our system. While we grapple with this rapidly changing landscape during COVID, we assure you that DBHDS will fight to ensure services people need will continue. And beyond that, we will keep our eye on initiatives like I've mentioned above that promise long-term success in meeting the behavioral needs of Virginia's citizens. Thank you again.